Coming up on Prime, the new documentary, The Bullying Project, takes a closer look at this issue of bullying in today's schools. We'll explore why plastic surgery is on the rise to stop children from being teased. Prime starts now. Hi, I'm Emily Hargrove and welcome to Prime. So bullying has some serious ramifications, and in some cases, children and parents are turning to plastic surgery to stop their children from being teased. This is a controversial topic, yet in some cases, it changes the lives of many, many people. I am here with plastic surgeon, Dr. Sule. Thank you for being here.
Thank you for having me.
And we are going to talk today about the cases that you've seen with bullying and plastic surgery and how sometimes they do fit very well together.
Absolutely.
So tell me, in your practice, how many cases of bullying have you seen?
Certainly throughout the last several years, certainly seen a big rise in this. Children, before, the idea of plastic surgery in a child was somewhat foreign, but as bullying has become more prevalent, and some of the aspects of bullying is teasing, differences in physical appearance, parents have been more open to having their child seen and evaluating their options.
Right, and I read that 30% of cases of plastic surgery has risen 30% in children in the last decade.
That's exactly right. And those typically tend to be different age groups. And children, especially elementary children, tends to be things such as ear pinning, or what we call an otoplasty, where children have outward appearing ears, which unfortunately are horribly teased for things like Dumbo, or for whatever name you want to call them, to chin augmentations when they appear to have a small chin. As you get older, noses and other aspects of facial features are more prevalent then.
Well, this segment of the show has a very, it's got a very personal thing for me, because when I was 13, I went into surgery and had my ears pinned back. Obviously, I've got long hair now, so you can't see it, but I never, for all of my life, I never would have my hair back, and I was just like the child you were talking about has that, you know, I got teased for being called Dumbo and for being called Noddy, for a cartoon character in England that had really big ears. And my mother was very much like, we have to do this.
It has become that way, that both for the child and for the parent, it's such an emotional pitfall for them that children can be almost relentlessly teased for such a simple thing as an ear, when you realize as an adult it may not matter, but for children it truly just is a magnet for physical difference that causes them to be teased and bullied. And
it's so heartbreaking, because there's just, it's so unnecessary, but children can be so mean, and actually some adults can be mean too.
Right.
But let's not put it all on children. But
right.
And it's just interesting, because as I said, in the opening, that it is a controversial topic. I mean, some people are just like, no way, this is not something you should be doing. You shouldn't be changing your child's look. But when you see the other side of it and you see them come out of it, it literally changes their life. It
makes a big difference. There's always a medical issue and a social issue with plastic surgery, and especially plastic surgery in children. In terms of specifically ear pinning, the ear is physically formed by the age of 6 or 7.
Right.
So at that age, it is medically acceptable to do something like that. However, there's always that social issue of, is this appropriate for a child? And that's what we're seeing more and more of, that children are realizing that there's a social implication to having some procedures done.
And if you, through your work that you do as a plastic surgeon, and you're a double board certified facial plastic surgeon.
That's correct.
Right. So, I mean, with the work that you do, and if you can help raise somebody's esteem and nip that bullying in the bud, I mean, then why would you not do it?
Well, that's kind of, in a way, when a child has cancer, we obviously treat that cancer with chemotherapy or whatever's available.
Yeah.
In some instances, this is a self-esteem issue. Your physical appearance drastically or severely or intuitively affects your self-confidence, which is a key component to growing up.
And one of the big reasons why we're here here today talking about it is because the documentary Bully, is in
That's right.
is in cinemas nationwide right now, and we're going to take a quick look at the clip. But that really hits home just the relentless teasing that children have to undergo by their peers. So let's take a quick look at Bully.
The last couple of days, we had heard that Tyler had his head shoved into a wall locker. They said he was a geek.
My concern is that you were making someone feel so uncomfortable that they didn't want to be in school.
I feel kind of nervous going to school because I like learning, but I have trouble with making friends.
They said he was a geek. Some kids had told him that he was worthless, to go hang himself. And I think he got to the point where enough was enough.
Tonight, a tragic situation.
A Perkins boy, just 11 years old, believed to have been desperate enough to take his own life.
Oh, that clip just makes me want to cry. But the little boy in there with the glasses, and the children call him Fishmouth.
Fishmouth, I believe. That's right.
And so, in your practice, have you seen any cases, distinct cases of bullying that have come in? Absolutely,
and it's unusual too, because not only do you see it in children, but you also see the effects of it in adults. I've had children age 6 to 7 to even people who are in their 60s. Who have come into me who said, as a child I was relentlessly teased for my ear appearance or my nose, and that has stuck with them throughout their life. So it's unfortunate, but it's sometimes the physical appearance can stick with someone for their entire lifetime. And
and I think you mentioned earlier that there was a 60-year-old man that has just...
That's right. I recently operated on a 60-year-old man who had an issue with his ears. He's had it his whole life, and he remembers being called a Dumbo, big ears as a child. And even throughout his adulthood, whether someone was calling that or not, he was always self-conscious about this, because he remembered as a child being called this and just feeling so low about this, that even at the age of 60, he said, I'm finally doing something about this.
Wow.
And he even had someone who was in her 20s who had something called a saddle nose, deformity of her nose. Who went through elementary school, high school, even college, just so inward appearance because of her nose, that she finally had it done, and it opened up a whole new confidence in herself afterwards.
And isn't that wonderful that you can help that?
That's right. Something that can be relatively simple can make a big difference in someone's life, and that's what I find very rewarding.
So when people come to you and say, they have it's the controversial side of things of, why are you doing that? What is your argument, to people that are the naysayers about plastic surgery?
Well, plastic surgery, I think, is an avenue to help with self-confidence. Certainly there are some issues in plastic surgery which should not be done, especially in children. Nasal surgery, rhinoplasties, and say someone who's immature or perhaps doesn't really want that they're being forced into having surgery, that shouldn't be done.
Right.
But in other areas, when we can help someone's self-confidence, help someone's self-esteem, we do that with straightening people's teeth, with any sort of thing that can help their self-confidence.
Yeah.
We do it, and it drastically helps someone's abilities in the future.
Absolutely, it really does. And dentists do it. I mean, it's everywhere, isn't it?
That's right. How someone appears on the outside affects how they feel in the inside.
And then that can take you through life. I mean, how you feel inside. I mean, how you can project yourself from the inside to that you can be the most beautifully attractive person in the world, but inside, if you don't feel it, then you're never going to project it. It's never going to come out. So, however you look, I'm a huge proponent for it. So, how do you prepare your patients for the change in look?
Well, oftentimes what we do is go through a detailed idea of what the procedure involved, the care afterwards. And we actually have technology where we image photos, show a before and after, so that before any procedure is done, they can get a sense of what they will look like afterwards, so that they can mentally prepare for that, both a child and parents also.
And when you see them in the office, and I mean, do you see their eyes light up? Oh my God!
It's amazing how like you said, their eyes light up, just they sit up straighter, they almost feel better as soon as they see that.
Just watching that.
Exactly.
And are you ever in the situation where a child comes in and you feel, okay, this is not the child's choice, this is the parent's choice?
Exactly, especially in an adolescent age. It's surprising, but in that adolescent age group, you often see males and females who will be accompanied by a parent. And for whatever reason, you get that sense that this is not the child's choice, that they're there because the parent is pushing a certain agenda. And it's imperative upon the surgeon at that point to say, let's back off, let's assess this when you're a little more mature and able to make your own decisions at this stage.
And so you have turned around and said, no,
Yeah,
I'm not going to do this.
I don't feel comfortable that this is not an appropriate use of plastic surgery.
And what reaction do you get when you say that?
Sometimes a combination of either anger or thank you for being honest and you're right, and sometimes anger that you're not doing what someone asked you to do, but it's your ethical obligation to do what is appropriate.
Well, that's so refreshing, because I'm sure there are some surgeons out there that do not have that ethical obligation.
Unfortunately, you may be
on
right.
the whole, yes, but it's refreshing to be able to go into somebody's office and for them to say, no, this isn't correct.
Yeah, and like I said, I think that's imperative on any surgeon to do that, because patients come to you for your medical knowledge and to develop a trust that what you're saying is appropriate and correct.
And you do, and aside from the work that you do in your practice, you do a lot of pro bono work.
I do, not only in terms of children and bullying, but also battered women. There's a society here called Face to Face, where through multiple battered women shelters, we address facial fractures and the unfortunate physical scars of battered women syndrome.
Oh my gosh, and that's heartbreaking as well.
That's a very sad issue too. It is. It's but it's the same concept in a way that it's amazing when you're able to address some of the physical detriments that someone has. The self-confidence that a woman will have afterwards, sometimes it's enough for them to help them leave her husband or develop that self-confidence that they can go on their own.
Yes.
They can be fine.
Yeah. And you know, just in wrapping up, what would you say to people who's looking for somebody like you? You know, what can they expect, you know, for if they have an issue with their child or you know, they're an adult, what can they expect when they come and see you?
Well, I think what the main thing you should expect is to have an open and truthful conversation of what the issues are, why something needs to be done, and the risks and benefits of that. And through that truthful conversation, an appropriate decision can be made.
Well, I think, you know, just having known you for a very short time, you exude this level of I would come into your office and I'd be like, you tell me whatever you need to tell me. So thank you, Dr. Sule. Thank you so much for being here. And if you want to learn more about Dr. Sule, find him online, drsule.com or 972-960-2950. Thank you so much for being here. I really appreciate it.